What to do about headaches? A viewer asked me if I could do a self-massage video that specifically targeted headaches. If you don't want to take medication, sometimes medication just doesn't cut it, or maybe you don't like to. Self-massage is a great way to relieve some headache tension, relieve pain. There are so many different kinds of headaches and so many different causes that some techniques will work for some people, some others. So I'm going to show you several techniques, and you could take the ones that work for you depending on where your headache is stemming from. Some might feel better than others. We're going to really focus on loosening up some of the connective tissue and relieving tension overall. Okay, so first I want you to have a seat. Try to sit up nice and straight, be well supported. Maybe a lumbar support pillow can help you. And just close your eyes and take a good couple of breaths. Try to extend the exhale long. And when you breathe in, think about breathing into your belly and widening there. In through the nose. Long exhale, relieving any tension. Okay, so first I want to get temporalis, which is a big muscle all around the ears. A lot of massage videos that I found on YouTube do things very, very quickly. Circle, 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 circle. I'm a big fan of taking your time, going slowly, really feeling what's happening, really noticing. Find where there are areas of restriction and really hang out there for a while. So what I'm doing is I'm taking my fingers and doing little circles and practicing different directions. So back, forward, and you want to be deep enough that you're moving the skin. Nothing should be painful in any of this. Maybe a little sensitivity, but nothing painful. And when you find a direction where it feels a little stuck, like the skin isn't quite moving as far, maybe it's compared to one side and the other, it's not going as far, or maybe just in terms of forward, back, up, and down, maybe up, it's not quite going, it's a little stuck. I want you to just hold it in that direction and just let it melt. Take a couple deep breaths, feel it release, and then move on, and we can go all the way around the back of the ears, all the way around the temples, just exploring where it feels good, exploring where it could feel better. Get into the scalp, really moving the tissue. So you see my forehead is moving with the tissue. That's what we want to do. We don't want to brush over the skin. We really want to try to soften that connective tissue. So you can pull apart and wait there for a while for that to release. Maybe there's a direction forward or back where you feel like it needs to have a moment. And just do some circles all around. Feel tension seeping out. Try to keep your shoulders relaxed as you do this. Sometimes taking a deep breath helps. All right. So the next thing I want to do is the jaw, which often has so much tension, along with headaches. Okay, so come on either side, again with your fingers, and just do some nice circles right in front of the ears. You can do the temples. The temples actually here are attached to the jaw. If you clench your teeth, you'll feel the muscle pop out. And you can do circles, or you can just slide down, relaxing the jaw. Sometimes it feels good to go under the cheekbones here. Get your fingers, kind of go in and up a little bit. Let that release. And you can slide that down as well, letting the jaw dangle. And what feels really good too is if you take two thumbs, our tongues get really tight too. So if you go right under the chin bone there, not too far back, but just beyond the bone where you feel a little softness, let the jaw be loose and just alternate gentle presses into the tongue there and really let it relax. This can be profoundly relaxing actually, and release tension from the head. So when you feel that your jaw is nice and softer, let's go to the SCM or sternocleidomastoid. A lot of times trigger points in this muscle can result in pretty terrible headaches. The way you're going to get that is to bring your ear towards the same shoulder, and you'll see that pop out over here. Mine is very, very prominent. Yours might not be as much, but you should be able to feel it. I want you to softly take it in between your fingers like this, kind of a little soft grasp, just so you have the muscle. And you're going to pull gently downward over the direction of the muscle, which goes all the way to the sternum. So you're going to pull sort of forward and downward as you slowly, slowly tilt your head in the opposite direction. So I'm just holding the tissue really and letting it melt as I move the head in the opposite direction. This should feel really good. It's a really nice stretch. Go gentle. Nothing should be forced or painful. Just really focus on the tissue. Feel it melting. Allow it to release. If you don't end up going anywhere or sliding anywhere, that's fine. That might be it for today. Or what you can do, I'm going all the way to the sternum here, is if you can't really get much movement, just kind of wiggle a little bit, play with that, and then move on to the next part of the muscle. And get a little, just feel it move. You can do a little circular massage on it. So what I'm doing is this with my fingers, a little circular massage to make it feel a little softer and get some tension out. Okay, let's do the other side. So I'm bringing my ear towards the same shoulder, grasping the muscle at the top. It goes right to the mastoid process, that bone right behind the ear. Take it softly and begin to move your head back in the opposite direction. So I'm moving like on a back diagonal. Okay. You can come back, you can play with it, you can see where it's restricted, moving around a little. No yanking, just letting. When you feel it stuck, deep breaths really help. Thinking about breathing in some happy little oxygen molecules to the tissues and breathing out tension. And just letting that melt. See if you can let your head kind of go with gravity all the way down to the sternum. Okay. Upper traps, and really all these tissues here along the top of the shoulder are a big contributor. So it's easier, I think, to take your opposite hand, and what you're going to do is just grasp. If you raise your shoulder, you can grasp the tissue a little easier. So you raise and then lower it down once you have the tissue in your hand. Okay, and then play with movement, bringing your ear towards and then slowly stretching away. So I'm just keeping my hand pretty much where it is and just holding it and allowing that to stretch as I move my head. Again, nothing forced, nice and easy. When you feel a barrier or restriction, hang out there and breathe. Okay. And you might want to explore different areas along these muscles, these tissues here, because some might be much more sensitive than others. You might even feel referral pain, meaning you might press into an area here and feel it somewhere else, a pain area in another place. That's a trigger point most likely. So hang out there. Only use as much pressure as is comfortable and very tolerable. It might be slightly annoying, that's okay. It might be slightly sensitive. You just don't want to go into ouch, kind of ouchville. So again, releasing there, and you could play with that. Let's move to the other side. Of course, I'm moving on a little faster for video demonstration's sake. You could lift if you have some trouble grasping the tissue. And it's just like a squeeze. You know how you love to have your shoulders squeezed when you get a massage? It's basically that. I'm just using more of a pincer grasp here. You could also bring your ear towards the shoulder to get a better grasp. It slackens the tissue. And then just allowing that to release with the movement. Deep breaths. Now, one of my favorite areas to work, which is so prominent in headache, pain, and all kinds of even nervous system related things, has to do with your autonomic nervous system, your rest and digest, and your fight and flight, the suboccipital muscles. And they are right under the bony ridge of the skull. Right under that, there's a soft place right under. If you put your fingers in and up towards the bone, it's almost like an in and under, but most of us are not going to get under the bone because it's too tight. So if you just put your fingers in and up, and you'll feel it. I'm on either side of the spine right now to get a little softer, and my pressure is kind of in towards each other. My fingers are in towards each other and up. And what I want to do is hold that and very slowly start to lower my head down as I hold that. So your fingers will start sliding downward, down the neck as the tissues are stretched. Breathing and just letting the chin slowly roll towards the chest. I sometimes feel like it's helpful to vocalize it too. Actually exhale on a sigh. The voice is very effective with the breath together. And you can again kind of go back and forth, up and down, so the tissue relaxes as you go back, and you get a stretch as you go down. And relax and stretch. It might help it to soften up more that way. Okay, and when you get all the way down, as far as you can reach, go ahead to the next position, lateral to that. So we're off of the suboccipitals here, but along the suboccipital ridge. So we're more on the outside now. And again, you can go up and down, feeling the tissues soften and release. Soften, stretch, all the way down. You should feel a nice stretch from the base of the skull, or even from the head or higher, all the way down the neck. When we get to the outside, let's go along this muscle here. We have a levator scapulae here, which is also a big contributor. Lots of trigger points, often very tender. I like to take my soft knuckles, just really soft, right under the bone that's behind your ear, behind and a little lower. And again, lean towards in order to slacken and kind of get a grip in the tissue. What we're doing here is called myofascial release. It's actually pretty advanced if you don't do massage therapy, but I think you can handle it. And it may take a little practice, but it's great when you can get a hang of it, because it'll be very relieving for your headaches. So I'm just going back and forth. It's called active release because I'm moving actively as I allow the tissue to melt. You can go back and forth, or you can just slowly let it stretch as your ear goes towards your shoulder. And deep breath. All the way down. Stop and hang out if it's restricted or feels tight or feels like it could use a little more attention. And you can repeat these several times. I'll move on to the other side. Soft knuckles. We can go towards to get a grip, slacken the tissue, and stretch the tissue. And then back and forth. Or we can just allow it to go. And if this is too painful, or you feel like it doesn't want to go anywhere, or your head doesn't want to move, you can just hang out here and let it go. This is totally fine too. And you'll get a good release in the tissues this way as well. And all of this stuff has much healthier, and if you do it regularly, much longer lasting effects than popping some painkillers. It's all good stuff. Okay. And now to finish, let's just do some light brushes across the forehead. Just light, soft, gentle brushes all across, nice and slowly. Close your eyes. You can go down your face. You can go back on your head. You can give your ears a little squeeze, a little circle. Ear massage is wonderful. Check out my ear massage videos. Okay. And I want you to roll your shoulders because your arms and hands have been doing a lot of work. Nice big rolls. Shake out your arms and just let your arms and hands dangle at your side. Sit up nice and tall. Tuck your chin in a little bit towards your spine to make sure you're not extending your neck like this, but you have a nice tall posture with the vertebrae resting one on top of the other, and almost feel like a string is holding you up from the top of your head, dangling from the sky. And close your eyes and take a couple nice deep breaths. Great. And like I said, pick and choose the ones that work for you. You can spend as much time or as little time on this as you like, and let me know what works for you and how it goes. You can comment in the comment section below. Do subscribe to my YouTube channel because I've got lots of good stuff like this. You can visit my website at rachel-richards.com and sign up for my free e-newsletter. I hope your head is feeling great.